Excel sha Ferry Bafetu dumelang sanbonane le kae ma Afrika Borwa. I'm your boy FarryTheeMc ke le sogana la go tsoga marishane la go hloka makoko. Welcome to season 3. It's episode number 1. Re thomile ngwana ka ke 2024. Compliments of the new year. I hope for December let's celebrate le sharp. We thank you for following us on TikTok and all social media platforms. What you're watching right now is 5 minutes on the streets. And this year, we came with a different style. We came with a different concept on this season 3. The episode is more educational than entertaining. They are entertaining as well. So it's an entertainment day. But this one is a different one. Like I mentioned, it's episode 1 of season 3. Don't forget to subscribe, like, and comment, or follow on Facebook and all social media platforms. Remember, this episode is sponsored by Nkopo Stilll. You can get them at www.nkopostille.co.za, or you can follow again TwRespect. You can see their merchandise is here. They sell caps, t-shirts, and all types of clothing. Follow them at TwRespect. And then we are also sponsored by Young Bros. Le Ashner. Yeah, so I'm just gonna drop all the sponsors episode and sooner or later, now on the podcast, you're gonna get them at your nearest retail stores. So we're just gonna drop them. So make sure that you follow us. We will support them. Today I'm having a very special guest because we're now PhD in 7 years of school. Dr. ES Kgoete.
Yeah.
Macutcut.
Pari.
Dr. Shaf.
Sharp, buena.
Shaf, welcome to 5 minutes on the streets. Thanks for honoring the invite. Ke social media last year.
Yeah.
Kere munno ke tlo motlisha. Yeah. Ya magala ba gona Macutcut. Why ba gona Macutcut?
What's again?
Eh.
Ke tabela gore ke rata go ripa fela e bona ntwe ngwe le ngwe go ripie ke krele gore okay ka mo matsogong ka mo ke feel ka go ripa ya o bona ke tla mo tabeng tsa go ripa
le nama
ai le bo chef ya bothoma gona mo
wa ripa
ya ke a ripa everything. So to be precise, ba tabela gore ripa nama tshila tsa go lekelela.
Okay.
Ba bona tshile le gore ke tla ibitsa molodi o skin.
Oh.
Yeah. Circumcision in a way. So le tse dingwe ba di bitsa di keloids.
Yeah.
And then the lipomas, the body cysts as well.
Yeah.
Cut. Yeah. Rata go ripa wa ke tshile gore ke ditso tse sekolong tseo.
Yeah, ungo no re tlhalose ga nyano di introduce sharp because rena re le batho re le so doctor no bona dino swana ba bona and asenna ke no shi itse gore ba bantsi ba no doctor no go tsara doctor ya dilo ka moka. So wena o ga re tlhalose maybe you start with your full names, tell us where you from and or botsele gore what kind of a doctor are you?
All right. Wena ke na Dr. Ephraim Shatalogolo Kgoete. That's my full names.
Okay.
Yeah. Our mengwaga is ka metara.
Yeah.
What the compare over the other gender was that's fine. And like all the that's where we are.
Yeah.
Then if you let him I decided at the age of I can't remember, but I was doing grade 4.
Yeah.
I was again medicine.
Okay.
Yeah. You like grow up paste like more classing about what you wanna be when you grow up. Cano rai. Erkeba tsene. Mangushi ka apply in matric but reject muka.
Yeah.
Why one? They rejected me everywhere.
Yeah.
Luckily negative application commitments.
Yeah.
Imagine go to regret UCT University of Pretoria and all those things. Utsi me twinsa ke ra ba go respond to gore ba go jere to rola mele taxi
mara wo phasi ga botse
mara be ke phasi je ga botse wa distinction ya mmetse yona ke jere yo bona I me twinsa mola ba ra okay sharp phakathi inside but I'm admitted ka la go ke January ke confused tax tsa tsere go direge yeah gape ampore ke give up ya bona so a wanna ke nna moshimanyana wa yellow bone go tswa ka mo go ditšhong Jane First awa ke na le mathata ke rata ke ithatela fela go ripa nama.
So what kind of a doctor are you?
I'm a general practitioner.
General practitioner uriang.
Kore wa tse thoma yo general practitioner.
Yeah.
O ya sekolong wa fetsa o ba internship for 2 years.
Okay.
I get from there internship with the community service for 1 year. After mova you're still in government again over a grade 1 medical office. From there you can decide what you want to do. You can either open your own practice. That's what I did.
Yeah.
And then ba bangwe ba specialize community service. It means they go back to school.
Yeah.
Now I specialty. I'm just doing general work.
Oh.
And so general work cover almost everything, but other things still over the I can always refer to other people, or to hospital, to other specialists. Yeah.
Or a general practitioner, because most of your questions, thank you for those questions that you dropped on Facebook. So we're gonna be covering a lot of those questions, because I remember I told him I was preparing for the episode. I prepared Mara after you guys suggested the lymph question. No, let me drop some of my questions and then get Fagele, because this episode is about you guys. Doctor, why did you choose to do medicine?
I believe it was a calling. Yeah. Because I think jiga ga ba mbutse ba re kenya go ba you know tsena straight ka renya go ba doctor
aseng go rata dikarenya tse dingwe
awa
yeah
you know tsena straight ka ratsa ke nya go ba eng ka ra doctor ba bamba re taxi driver ba bamba re mapolisa ba bamba re ditsotsi ba bamba re di vampire
yeah
you know tsena straight yes but you know what I want to be this and vele ka pusha until high school. It's in pedi ba pedi kwa Marshall.
Oh, tsene mola ya mola ga botse go jadi le nna lambona. I'm the doctor of the podcast. Yeah.
O benda so ke tlhalositse gore ampor ke sa bodire because ne ba rejectile anyway. Mara gore ka re ke calling a gona gore
a gona gore ska ba ri ga ntwa e bodimo e ratile o ratile.
Awa modimo le badimo ba ka bana ra we ne ba fana when se khethile go ke sa gago.
Tell me about the journey. We hear that people go for 7 years. 7 years ke telele doctor.
7 years?
Yeah.
Ke ba khale ba.
I was
rena ba banana ke 6.
6 years. Yeah. Okay, but still 6 years is still a lot. I mean, nagi just call on 2 years. Ke dira mechanical engineering. Libile aka fetsa. Kore no bona gore ga botse wena just 6 years.
How
was the journey? How was the journey?
O me 6 years yena sisilo nje. Awa.
Yeah.
What's a phele university bonyaka eng as a doctor?
Yeah.
Bonyaka balance.
Okay.
Yeah. I would say na mola first year. First year ka re ke matric even. You know, first year ke matric. We try the biology, the physics, the what. Then on that program over ke practice of medicine 1. I know one child okay. You do basic stuff. Maybe the blood pressure, which is sugar, which is stuff like that. Yeah. So the journey was quite hard, but doable. The challenge is nearly by. First year was the easiest. Second year, how it's in. Yeah. Yeah. Very muripi mo.
Ano mo tisha stop so.
Ke holo itletse. Le dissection hall itletse so ba ve ile ka rotseng ka re ga musha. Ga o tsena mola a se gore ke tshusha batho mara ke reality. Wa tsena ba go fa buka.
Yeah.
You cut according to the book. You identify every structure in the body until you finish towards the end of the year. You must be knowing every single part inside the human body.
Sinjela re di balanga life science go ba di
pala. Wa tsela ba di troile go ka re o di bona life. Ntona re ntwa tlhokofetseng in medicine re mitsa cadaver. We don't call him or her corpse.
Oh, okay, cadaver.
It's a cadaver mo preservable.
Oh,
for the actually you can use that person the whole year. So that was the challenge. I would say Nakamola.
So when I wanted to pusa oh no.
Yeah, I could slagane really 4 or 5 depending on number ya RENA. Yeah, but allocate.
Like are you really gonna even cut the head?
Everything. I was just saying. you know about the brain akere skull se la ba go khathela sona ka motšhini already you can over exposed brain e le ba exposed to kgona identify.
And where do they get this cadavers?
Usually ke batho ba le gore a ba claim ke family.
Oh,
batho ba le gore ba latlhegile maybe ba beile there for 6 months or a year a gona motho ba claimang unknown people especially it can be for anyone, it could be somebody.
So the government didn't decide that.
Yeah, or no, this can or ba bang ba donate gore ba khathiwe ba or RENA re kgone ithuta ka bona.
Okay.
Or na tlhokofetse mo ke nyaka gore you know what bana ba ithute the upcoming doctors ba ithute ka RENA.
I'm sure it's only white people who do that.
Le batho ba baso ba dira so maybe if you because ka go ne go sna the white person that I remember, maybe it could be one from another table because it's a big hall.
Yeah.
But mostly it was RENA yeah. So third year was the easiest.
Yeah.
Fourth year. Yeah, motho a feitsi mola o tlo go botsa re a bja dia boa. From actually do go from second.
Second ka nako last.
Mara ga o ka motheletše a re dia boy o tlo shalla morago tata o bala o tlo phela o nagane re subject e tlo mpetsa a bona le nna ampore sorry ampore ke shala because of one subject ba re ke physiology well because e nngwe impoditse gore e diaka ku
sala go
tshosha ra you know what here dia bo and eventually no ka feletsa ke tsene ke passitse go sna le bothata one. So moving on to third, it was quite nice. Fourth the one subject for every year a subject is difficult. Fourth was also difficult, but the nicest thing about medicine you have 5th level and 6th level. You really spend your time on practical work. Usually you are in the hospital full time, you see real things. You're always in theater, depending on the block. Radiology, but the blocks. So the blocks in over is subject. It's like a course on its own. Maybe like cover and exam. You're done with it. And then maybe maybe internal medicine. You're done with it. Maybe surgery. You're done with it. Over block 6 weeks or 2 months, depending on by allocated duration. So until 6 years, that was the nicest. Because fail come on.
Why did you should do doctor?
Well, most doctor. Well, for you,
because I'm trying to cover everything in once, and there are a lot of questions. So now I'm going to the friends of 5 minutes with Ferry questions. These are the questions from the squad. The squad is those people that are watching there. So the first question that they asked, they said, if African meds and Western meds can work together, can work in hand, or if it can be considered in health by WHO, can these two doctors really collaborate in hospital environment in an interest of a patient?
About African meds, like African medicine.
If they can work together, if it was to be approved by the World Health Organization, can they really collaborate in an hospital environment?
It will be my because now Western medicine is in Nosh. I want African medicine is in Nosh, but then there do more of a collaboration. Because looking at other things, so there
are cases whereby
I remember I had one patient, not or like Eboloi, but Mola Negosa, you withdraw blood from the patient. Immediately, in a second, Madiela for at very fast. I will allow I can come a chup asale rabot. Okay, treat maybe tomorrow in order the same thing. Then you feel a life specialist is about
and it's not normal.
It's not normal. But those diseases get rare diseases.
Oh.
And then you show and ka se African le ne tlo go botsa ga botse gore ai o ka re bo ka se berekega wa ngusha. But the collaboration e ka ba a nice thing, but mo le gore a ke re vele bereka ka di approval le di accreditation gore ba tsene sepetlele and what so not. E ka ba nice go bea a traditional healer or ba le somebody from the western side, doctors ba collaborate re kgone bona gore okay, are we on the same page now? Because now we're on different pages. If hospital can work, can help a patient, we are dingaki. That's true. And our fitla ka mola dingaka tshele go tshoro some of them ba dirang ba go botsa ka boloi ba go botsa ka go rojesitswe wa ba dira whatever hane ba bangwe ba khosa mo harm because aba tsebe go regulate dihlare tsa bona o kere go di cause di kidney failure, di cause di liver failure ba boela gape sepetlele. Why one? So it will be nice if we come together in a hospital and do that thing. We wish it could happen. Okay, malwetse a tlo treatiwa jwang. And then the medication, the herbal medication, the kgone regulatiwa just like the Western medication.
So all the medications they were from the ditlhare tsa Africa.
Ke a dumela, some of them yes.
Most.
Yes,
most.
Some of them yes.
So a le bona o kare ge re ne banna bale o kare e ka ya re berekela ga botse because nako nngwe ke re banna bala ba ne metšhini ya go scanner or what's the problem.
Yes.
So e ka re berekela ne
e ka re berekela because ape looking at it this way ne about in the Western field ba make sure gore ba go fa the dose ba go fa yone ya span and ba sure gore ka di side effects di jwang or the damage that drug it can cause. So ka mo go Western aba sure ba go kalele ga botse gore quantity e
African
at least come about the protector too much mo le gore that's why it's heavily regulated. Other drugs ke di schedule tse di high mo le gore o ka se no e shumisha fela. They want motivation for you to use it, they want approval for you to use it, and do you know how to use it? I shumishe ke man le man. And lo wena you stand a risk ya gore I can react on the patient ba ka kgona go blame gore you've done something wrong, but you are trying to help.
I can tell you to the next question. The next question is a very funny question, but it's a nice one. They say, does penis enlargement and cream work? The cream injection is just a yellow bone. But do they really work?
Oh, cream or my yellow bone. Penis enlargement. They call Dr. Mamusa. I think those people really doctors. I don't know. Because okay, in penis enlargement, surgically in our field, there are no pills to enlarge the penis. They are no pills. Penis enlargement exist surgically. Operation, they can enlarge it. By all years, they can elongate it. Or they can increase the girth. So, I want the pills. So, 4-5. We ba ska go botsa maka.
Ba konelelwang ga botse.
In medicine, there is no such.
Oh, in medicine?
Yes, in medicine. But in the Western, re go ba bangwe ba re no ba godisha mehlari, godisha dijana. I'm sure about that. But na ke sure ka mo gore na gore the only way mo le gore can increase the penis size is through surgery.
So there's no pill yo ileng wa go ka yona.
Pill no a ke tsebe.
Na re tsebe ba gala
le ka black market.
A re kwane ka ya go hlaba le cream.
The cream. Ja gore ya batho ba yellow bone.
Bereka. And di gona be.
Re ba be se ba bona ka re ke di newborn tsa dikolobe mo STRATA. Mo tsala tag mo ale yellow mo. Jona di gona. But ke tsa di black market. Wangwisha. usually they've got dangerous chemicals in them.
Yeah.
The mercury and other funny chemicals. They bend the skin. They remove the top layer of the skin.
Oh.
They remove the top layer of the skin.
Yeah.
And that skin, it can't grow back.
I swele.
Side effects. Yeah, I swele. You'll find the horror when chiva swele ba chuva.
Yeah.
You get what I'm saying? Or banale baby tang. Barking hyperpigmentation. But dark mo pinky and stuff like that. So get it black market product.
Yeah.
The injections are marago. I will not get it.
I don't want medicine. They are not medically approved.
They are not medically approved. They get you just black market.
Ilore mara agro gonele batho ba ilore di ba di dirile like penis enlargement. Your cream, your injections, your marago and stuff. But what di dirile and those things di godile. Ilore these things di gona just that they are not approved because of the danger of them or what?
Because they are cosmetic, number one.
Agricultural
cosmetic, it's I got no problem with treat.
Yeah.
And I treat a seal moment to lower yellow bone.
Yeah.
Gay choice, yeah. So when I get anymore, I understand.
Yeah, yeah.
Okay, when about to bleach it,
yeah.
Who that thing is not approved by Dira behind us. Why, Kusha? Or by Dira Joang, I get the or Bashumisha, I don't know.
Yeah.
Or Kusha. So, RENA Kushor, I man. To Aronaga di Logeri sold in LA and stuff.
Yeah.
Shy away. Because I got RENA approved.
Yeah.
I will tell me side effects or into Erectile so. I have to stand in the court of law.
Yeah.
So we shy away from them. So in the black market, they just run.
Yeah.
Or we so as we can be always on the run.
Yeah. What are the side effects? Good level Jona penis enlargement. Leona, creamy rainbow or the chubaba. And the chubaba the dark skin. What is the main function also of that layer I remove you? So I want to know the after effects. Or the loge also not the deer. It will affect you.
To make a penis enlargement, do wrong medically or a
penis enlargement. When the case still yeah, the after effects
usually I grow according to the right side. So the other side is bigger, the other side is small. Maybe the shaft is bigger, then the tip is smaller. Or the other way around. Or lady infections.
Yeah.
And then infections they lead to condition where cellulitis. It's just infection of this under the skin.
Yeah.
So and then it can cause other major problems as well. That infection can go up to the body.
Yeah.
Per se. And then body lead that to what? By a cut.
What about by cutting?
They don't have the penis right now. Yes.
Hey, Bakala.
What 4-5.
Some pipe or something.
I get connect what you call catheters or the penis and above constructed, but I am sure. Technology.
Oh,
yeah. Penis. And then Irang, I am sure.
Yeah.
For just a forward. Construct
Lavon. Oh, yeah. Yo kile ka ekwa elo rawe tsebe ya gore ba constructor yo go tswa letlalo ngwana ka mo life science ya o ka re ba topala ra go gore serope ga ke tsebe gona mo
ene engwe ya go be ile yang side effect yang ya skin ne
ya skin
usually seba can be ska go expose go robele cancer, you know. I get well that top layer ina go melanin I get that pigment go for color. Yeah. Na ke yellow bone na ke na e too much the darker the berry
Africa
the sweeter the juice. So that pigment ga isego o re galang going to develop a cancer because I want to protect that.
Oh.
Well, skin cancer or skin so personal irritation.
Yeah.
And also you should the sunscreen always, and not only sunscreen when you overuse them. Effects just like albinos, their skin is very sensitive. There's a special type of treatments they go through.
The albinos bashota melanin.
Yeah.
Oh, okay.
Yes.
Okay. Artambeleng to the other question. I told you it's free consultation. What you need to do is just subscribe, like, and comment. Doctor.
Yes.
Basadi bare banyaga bare kona selo bare ke tape or bare ke prep. Akzo tape le prep or e wala ka da prep or ke.
Different things.
Yeah, I know wa ke kushije ka gore akere ba swara gua ke le gara ke nya ke shaka kushora maradi. E wala ka fapelete la prevention.
Yes.
Ne? Yeah. So mboje ka prevention ke ka moka. Di aketso ke kai and then mbojo di bereka jwa. Otomemo.
Yeah, lo gore nya go prevent eng. Prevention number 1 get pregnancy again.
Yeah.
So we look at BATHO and other things.
Yeah.
So methods of contraception.
Yeah. Okay.
So BATHO is an injectable contraception. You can inject it for 3 months.
Yeah.
It lasts 3 months.
Okay.
In your system. Then
Yeah.
after 3 months you can go again. Yeah. Yeah. Well, matabi ona barken STRATA. STRATA is 2 months.
Yeah.
Injection.
Yeah.
So on other methods of contraception, on the PLC. Combined oral contraceptions, and then the patch. Oh, sorry.
Yeah.
The patch. The patch, you just put it on your skin, either on the back or on the thigh. Right, this step that much. And then into come on, intrauterine contraception device. IUCD. Here we intrauterine contraception device.
Yeah.
By Kenya Kamahara Gugu if it's an Akamara.
Okay.
Then it lodges there. In 2 types. There is a copper T1, there is RENA. RENA is almost plastic, copper is like steel.
Yeah.
And copper aina contraception on top of it. It's just steel that you okay. Then RENA is just plastic like in a contraception in it. In a little hormone, hormone then sort of is a dual method. Yeah, interfere with the hormones, then do one develop pregnancy.
Okay.
Then we would say or
yeah.
That one came kind of working and like Sarah thing. Maybe Jagalina and a little thing hand. And was said by it's even talked how we live age.
Why but no comment. Give it a question really go on.
Why he live age? Yeah. But that one whichever I'll remember the name.
Yeah.
Whichever said headache, they've got irregular bleeding. I get recommended as a doctor.
Okay.
I don't.
Yeah.
At all. Yeah.
So basadi ba rile barne go butchore sharp. Dilo jo di badileng ka mokana ka tsona tšeo. How does one know which one to use? I think gore basadi ke butsitse ga botse. Because motho mo le mo a ga le o mo tlo go botsa ka tsona tšeo di badile ka moka ke dilo tšela maina tšeo.
Yes.
So dilo tše di leng 5. O a rile ore I'm sorry sharp o re rile I'm sorry sharp. So how does one know gore nna ke le so nka berekisa? Because they go to clinics, when they get there go tliliniki bana ba fa dilo tšela bana ba hlaba. They don't even ask them questions and stuff.
Yeah, you're right.
So and again, most of them they say they turn out to bleed, they turn out to have those headaches.
Yes.
So barbanya go tseba gore motho o tseba wang gore nna ke le mama I must use this one.
Okay. In that regard, family planning again.
Yeah.
Usually contraception I seen to gore sonje ro ishumishe forever. Again. Go na le tšile gore a ka di cover di methods tša go swana le bo condomize le gore batho ba ba e rata.
Yeah.
Le go ba faithful and abstaining.
Yeah.
And those they don't like. But in general, family planning, it's regular doctor. So you go give the options on the table. I know the side effects of these things, and I want to better than the other.
Yeah.
And I want to it's up to you or choose which one after the explain throughout the consultation again.
Yeah.
What decide that from there or no, I need this one. Okay. For an example, copper T doesn't have side effects.
Okay.
That intrauterine contraception device. Kana kamhara popelo. Aina di hormone.
Okay.
Compared to the nelete.
Yeah.
Or what? How shumisha nelete? Utlo create this kind of side effects. Utlo nona. Utlo hecha ukare. Aisa orate bote.
Yeah.
Utlo bleed irregularly. Utlo bali
Yeah.
di headache. In a long term, utlo bali condition ibaringi venous thrombosis. Venous thrombosis is just clot inside your veins.
Okay.
I understand that's extreme, especially if you use them long term.
Yeah.
That's why I get those ones. For an example, copper T, you can put it in your system in the womb for 6 years.
Yeah.
Without side effects.
Okay.
RENA is the same as copper T, but in the hormones. Leon can put it for 6 years.
Yeah.
Then for an example, the PLC almost the side effects this one later the injectables.
Okay.
The depols, the esterate. Why one? It's something family planning you're not supposed to use these things for the longest time. Didn't lady side effects. Let's non never pompe chukare stuff in your system.
Yeah.
They are not fine. They could they lead to obesity because little diet here is not on point. So
what you're basically saying is that ge o le ga go na le ga o kgona gore o tsebe gore nna ke le those things are they choose based on your system, they choose based on your planning.
Like ungasnap predict or your system this medication.
Okay.
It's a matter of trial and error.
Yeah.
Okay. Let me recommend a patch for you because you are still young.
Yeah.
The hormones react as well.
Okay.
Patch, you just every patch, you just put it on your skin. Then you manipulate the hormones or pregnant again.
Yeah.
Then we move on to the next method.
Yeah.
Okay. Which solution can we come up? I recommend that the RENA or the copper T intrauterine contraception device. Okay, maybe this one now you're better now.
Yeah.
I believe the side effects, the headaches and irregular menstrual bleeding and so on. So it's a matter of trial and error. Your system gas never predict or I can't do the test.
Yeah.
Or no, we're not living get this one.
Okay.
So trial and error.
So go basadi ba ile gore gantjwa le ba tshwenya ke tsona dilo tse tsa go sana le gore ba che like they are on those construct. Yeah.
Contraceptions.
Yeah, those
contraceptives.
Those things ngwana.
Yes.
Ba tshwenya ke taba tsa tsona di side effects tsa go sana le bo bleeding and whatsoever. What advice can you give to them?
We manage them in a way or we can change. First of all, which contraception method are you on? Okay.
Yeah.
Then get manage according to the type. Again, for an example, if you're on RENA, I'm just gonna remove it out of your womb.
Yeah.
Okay, try another one. Okay.
Yeah.
Then because of the side effects. Now, number two, if more neleting, shumisha depo.
Yeah.
If not irregular bleeding, offer the pills to stop that.
Yeah.
To restore the hormones because it's a little problem. We no bleed the tlaka.
Yeah.
So for everything in a solution sayon. If you patch, we just remove it within 2 weeks to a month, your hormones will be restored. So for our problem. These methods, the contraception.
Yeah.
We always switch on to the next one. But we want to know your goal. Or you prevent that until when?
Yeah.
Yeah. Because the side effects are always there. Side effects are always there according to the method. E le gore o ikgethile wena ge ke go hlalosetsa or no, this one is for me. So basadi ka moka sanjero ba no ba ska itja as a chronic, bana contraception as a chronic bana.
Yeah.
Ya fela le shumisa di condom or ge le blind ka pula. Ka withdrawal, ba bitsa withdrawal. But you as gore ke recommend mara ke ntse le gore ya di.
Yeah. So re go jambela question nya bona ya mafelelo, and then re tlo as no jambela gona re tlo tla go jaaka ra fetsa re wela go
gore ela prep e sa jwela pele.
ela ya prep ya ga ile gore ne wena wa informile well enough or o sa nyako sara on the prep kana se lo tedi one prep.
No, prep is ARVs now.
Oh yo are ape skolo are okay sharp. Yeah, tell me about the prep.
Yeah, prep we bija pre-exposure prophylaxis.
Okay.
Before we were exposed. Exposure prophylaxis treatment.
Yeah.
I got TVL, sort of prevention.
Oh.
Usually prep.
Yeah.
Ke tla divide okay. In a lady category je di fapanego. Ignore ina le gore nyako shumisha for eng e wena self.
Yeah.
I get it.
Yeah.
Re check up risk ya motho. Are you a high risk? Are you a medium high risk? Are you medium risk or are you low risk?
Yeah.
So the low risk here okay. You're not somebody who is sexually active that much, only one partner.
Yeah.
But maybe I will say partner we're gonna classify as low risk. Prep. Prep contains 2 tablets.
Yeah.
Inside 1 pill, but in only 2 combination of treatments. I get
okay.
We know every problem go every day. And it just start to verika after 7 days.
Yeah.
We no kasnori today then ka indulge into unsafe sexual practices.
So do you know every day?
You know every day as if like we not treatment HIV.
Yo.
Like okay. So PrEP is just prevention of getting HIV, but it's not really 100%. Okay. At least reduce the rate of HIV infection, either sexually, either or blood transfusions, or having multiple sexual partners. So we're trying to reduce that rate. Okay. So so get those pills, they 2 in 1. You take them every day.
Yeah,
I get it. Only low risky. You just have to get your partner tested or some status. I get it. The most important thing is to know your status. Then available the other risk. For an example, the prostitute.
Yeah.
No PrEP.
Okay.
The mine workers. The truck drivers.
Yeah.
Hey, have you get high risk? They are classified the taxi drivers.
Yeah.
Hey.
Busy.
Ba ya go menating ba ro re ba lo re ba tawili ba khoshi and then ba khona the towel. Le bona ke di high risk because ba kopana le batho and then they engage into sexual intercourse.
Yeah.
Those ones at least they should be on PrEP ba tseba gore ba tawole. But they promote issue ya sexual unprotected sex basically. Re nya gore batho at least ba try go shumisa di condoms. Even go njwa le ba introduce this thing ba ke vaginal cup. I'm not sure if it works 100%. You just put it in the vagina, in a little ARVs. I guess by passage or not, but that is not enough. Use condoms, guys. Use condoms, and then they can't tolerate condoms at all.
Yeah.
But I get to prep the STIs.
Yeah.
I TVL gonorrhea, I TVL syphilis, I TVL human papillomavirus or genital warts.
Yeah.
I TVL herpes, simplex virus. I TVL. You know, focus only on HIV and at least on hepatitis B virus.
Okay. Yeah. So we are going to the next question, and then from more to Doctor. Yes. How safe are morning after pills, and how often can you take them?
Yeah, when I'm watching South Africa, people use emergency contraceptive pills, generally morning after pill, as as their daily
Yeah, o ka re ba ja bogobe.
kore o ka re wa tsa keng, peanuts and stuff, as their daily method of contraception, kore ke
Yeah.
routine.
Yeah.
And then dilo tse le ke tsa emergency, but because philo na le emergency.
Aowa,
Emergency se jwang. Wene ba lapile ka kwa di-pharmacy ka kwa o phela o tlile.
ba di change dilo le tse tharo.
Dilo tse di na le level of tolerance.
Yeah.
Go fitla level gore a di sa bereka.
Yeah.
Which is, for an example, you come today, you take them today.
Yeah.
A go fete 3 days o nyako di tšea gape. O bona gore ya confuse hormone tse.
Yeah, yeah.
Go fitla the hormones tse di try go adjust gore okay, di try gore endometrium ela. Kore the hormones tse di try go bribe endometrium le gore ska catch. When after 3 days o confuse hormones tse, o tlo fitla o imi.
Mola di re bribe.
Bribe. It's just a bargaining, a method of bribery.
Yeah, yeah.
As a daily thing. Make sure, kore, the emergency pills re di shumisha basically on batho ba le gore go na le condom best.
Okay.
Even though they lie to us. Doctor, condom e best.
Yeah, mara a go nthom khuteng.
Ba ile le setla
Le gala ba itsebile. Ba tlo ba tšea tharo di shago tše 5.
Ai go tše 6. Wa e bona. And then reserve to those ones ba le gore ke di rape victims.
Okay.
Yeah. Or ba le gore ke di child abuse, vele ke di rape, leading to rape and all those.
Yeah.
So and le ba le gore no voluntarily vele ba no. Re ka se ba ganyetse, we give them those things. But you monitor motho wa gago gore this one e phele regular. And they end up not working because they reach a level of tolerance.
So how often can you take them? Re nyako tseba eo gore like is there a period of or ka kgwedi o ka ditaga tee gabedi? Yeah.
I will advise gore just try to avoid them at all costs.
Okay.
Guys, that's why you guys feel an emergency.
Yeah.
In a month, at least once.
Yeah.
Or melo khono recover. Remember the hormones, or menstrual cycle okay this step.
Yeah.
You still have another 28 days or if it's restore or you have stubborn. Depend I got overloaded when I got loaded mailing. So avoid those things at least when 3 months in over high one.
Yeah.
Don't have that time period to allocate, but just know where they will reach a point whereby they will not work and you will fall pregnant.
Okay. Yeah, let me make you play smash or pass right there, man. I think we've been busy on the on this stuff.
Yes.
So it's a game whereby you play. When I call someone's name, it says smash. If you come now pass over.
Hey, well, you go.
Doctor, yeah, I don't know if you know also the celebrities. You follow them.
If I don't know, I'll just say
okay.
I don't.
Okay, sharp. I'll just try to call out the one spelling or whatever. There's a lady called Shandesh. Smash your pass.
Shandesh.
Yeah. Smash your pass.
Hey, Shandi Baba. When you got a photo or a camera. Hey, you don't teach a kawan. I will smash.
Arga testa ganam. Gara arga testa kamu dia ganam.
Gazik. Gazik.
Okay, jab.
Maro bala laga ko smash agwa ka bazaki kwishi.
No smash gara
wala kiss again. O gona re fete.
Jab. Are go bogo. Macutcut special press.
KG. I'll pass.
Pass. Okay. I'll just put it right. Sharp. Kamu fem mama fito mzamo mahu.
Oh mahu.
Yeah. Udah stokos sebarang mahu. Ya matat.
Aish. Marah apa sih nak tera-tera di selen. Tamar awal smash.
Okay. Go far mafelelo go far ba mo gae. Nga mo fa mama nanga so first phala khala ke mo le mo smasher. Queen Minaj smash or pass.
Pass.
Why?
Maro tlo boletse go RENA ari ja mohutomo.
Or ayan.
Okay.
Shamar will let back to the stuff. Doctor. I want to know over Dr. Mezumo. Mezalaga.
Can I have water? Because I have water.
I got more afi. I want to learn more regam going. Yeah, let's go like Dr. Jumbo Jamu. The difference between STIs and HIV infections. The STI and HIV side effects. What is side effects? No, not side effects. What is the bon, I got to STI. There are some what the after effects that I see. What do you call them?
We just call them symptoms.
Yeah, symptoms. Yeah. Who is a life science? I want the symptoms, the difference between the symptoms, the STI, the HIV.
Oh.
Yeah, because on what I look at, I'm going to test green.
Oh, basically, what you say, the symptoms of HIV infection again, the symptoms of different types of STIs.
Yeah,
oh.
Yeah.
Okay. Sexually transmitted infections. HIV is part of them.
Yeah.
Okay. Because your eye is a special one, revealer on its own. Okay.
Yeah.
It cannot start because it's a pandemic in one.
Yeah.
So HIV infection, if it's a job,
yeah,
you guys feel it for next.
Okay.
Yeah. It can go up to 2 weeks, so feel next, or up to a month, or up to 2 months. So feel again.
Yeah.
Only in specific people, I don't know, the immune system is quite strong.
Yeah.
Others, they will have what we call seroconversion symptoms.
Okay.
It is flu-like symptoms. So, a very terrible flu. Before.
Yeah.
Or you feel wale mila fisher west. When flu symptoms, your nose might block, you might sneeze, you might cough.
Yeah.
Or the sore throat as well, but it is terrible.
Yeah.
You understand? Why we the seroconversion HIV symptoms.
Okay.
So feel, but only literature after 2 weeks.
Okay.
Or you can start feeling those kind of symptoms, or you don't feel any symptoms at all. But remember, HIV on its own is not a disease.
Yeah.
It's just an infection that can bring the immune system down.
It can be healed.
Oh,
okay.
I can say what I heal like a manga, but so it's something that can bring the immune system down because it attacks what you call the CD4 cells.
Yeah.
Then it destroy. Then your immune system becomes weak. Then what sure the symptoms and get the AIDS defining symptoms.
Okay.
That's not the TB, which is the common one, or the skin ones.
Yeah.
Just okay. You know it. Yeah, especially come only one side of the body.
Okay.
They can be from the face, half of the face, that's the other side. And they will go blind. You got the blisters kind of but we say the herpes zoster or the shingles. Ne? Then or half of the chest or the abdomen. I did you both sides. Then you come around mid spine I jump to the other side.
Yeah.
That's how we recognize it. So I want
HIV.
Immune system are really low. Then I can really see the first.
Yeah.
Dira or mashulam abe weak. Then what the AIDS defining symptoms.
Oh.
The AIDS defining symptoms chona chiki this sang. Like I get TB.
Yeah.
Yes.
Okay.
Little shingles, little pneumonia. So there are a lot. The list is very long.
Yeah.
because by classify according to stage 1 until stage 4 symptoms.
Okay.
What else just stage 4? Well, Kaposi sarcoma is a different kind of cancer. And remember, HIV on its own, it doesn't cause TB.
Okay.
You know, contribute our immune system will be low. Then automatically like
Oh. Yeah.
Yes. Then by the AIDS defining illness. That's it. Then other STIs here, another different STIs, but the gonorrhea, the transfer sexually.
Yeah.
And about gonorrhea, what was it? Gonorrhea ka kgona go fetela ke drop,
Yeah.
yes, e ka kgona go fetela go feta go mona ngwana batho.
Yeah.
A male can get it from a BJ.
Go mona or a maftown.
Eh.
Kinda nanga ya maftown ke kgono kry gonorrhea.
Arre wena go na le a lady le
Isa
gore
go ne batho ba abana bothata re mmereko.
a re no re wena go na le a lady o fa BJ anjana le yona in the mouth. Akere anjana le yona in the mouth. O re galang o ka e hwetša le wena. Doesn't mean gore oral sex le yona is very dangerous.
So le BJ e ka ntirela bothata.
E ka go riela bothata. With all the STIs.
Okay.
Yes, with all the STIs.
Yeah.
So we move on to the next one. Human papillomavirus. Human papillomavirus, infected, either you can see it or you cannot see it.
Yeah.
It presents the genital warts around them. Can be around the mouth or the inside, as well as around the genital organs down there.
Yeah.
Or around the anal region.
Yeah.
Yeah, ba batho go rata ka kwa mafuri le gona ba at risk.
Oh. Yeah, o gore re so anyane ke topic ya se ke ngwadile mara ke ile ka re ke boledishana le motho mongwe masneneng ne. So we were talking about gays. So I'm just saying this because I know maybe community le ba fana ba technology ba le village. How dangerous it is. Motho ba mpotsa ke tsorong informile ga botsena. How dangerous it is to do anal sex.
Ke tsebe ka ra senga area mara literature it's dangerous because the membrane is fragile.
Yeah.
For the skin covering the anus, actually the mucous membrane there is very fragile. It's likely to tear. So when it tears, anything can go in. But it's easy for you to get HIV infection.
Yeah.
And then it is also easy for you to get other STIs. But correlated a matter of probability.
Yeah.
Let's say regarding vaginal sex, le anal sex, almost but vaginal sex because HIV ne at a certain percentage. But somehow, let's say you're circumcised.
Yeah.
The risk of getting HIV infection from vaginal sex is 60%. It's 60. But in an anal, in anal they're not safe. They're not safe. So anally, for you to get the infection is quite high. Because it tears easily there. Fast, which is and then it's very tight. So another danger when it's tight like that, the anal sphincters.
Yeah.
Control break.
Yeah.
So
yes.
That's the problem.
Okay. Yeah. Dr. Abege was working. We are at half of the episode.
Yeah.
And I'm logo 1 hour. I was this episode. Yo. Bakala yolela le consult with tata ke la le ntire lambo thata mo episode 2. Dr. Derekala Bilonyana re kgone go tswela pele. But how does one see that they have an STI? Yeah.
One. Apeso itong gape le ke cover ka moka.
No mpotsa nyana ga nyana ke motho mo ga go fisha a totumela go sala le mollo la mollo totumela wa.
Ora arbe ga drop gonorrhea ke.
Yeah.
Gonorrhea ge motho ana le yona. in males.
Yeah.
But more fishy,
Yeah.
morotola wa fisha, and then ubali fever, milwa fisha, then uchwamash.
Yeah.
Discharge.
Oh,
Yes.
Yeah.
The discharge is coming out.
Yeah.
Those are the same. Or chlamydia. Gonorrhea and chlamydia almost present the same way.
Yeah.
Then the herpes.
Yeah.
Herpes simplex virus.
Yeah.
Lady blisters around the genital organs. Lady painful blisters.
Yeah.
Then
Okay.
syphilis. Syphilis is a painless ulcer.
Yeah.
Is painless. I swanelia herpes virus.
Yeah.
Which is at
Yeah.
all. Which is then genital warts. Genital warts are small growths. But I the one that the so on top, only generally painful around the genital organs, both males and females. Again, then another one again, syphilis guy on. Come on, Kilvala, where was there?
Now get to the sale. Get to the sale.
Yeah, he did not share.
Yeah.
Yeah,
So how can you treat them?
Treatment medication no tla mo go nna or clinic whatever ke re ba re tia ke mogwana ko yeah but they are treatable.
Nna ke go tseba gore ga botse pills tse leng gore wa dinwa ke eng ka lebijana banna ba batšha ba clinic ba tšha ba spedele mara ba ne connection ya go kry di-pills.
Okay,
yeah.
Gonorrhea, you just get one injection, Rocephin, and you get azithromycin and then flagell.
Okay.
At same time, how do you know the following day? You just drink them today, you are done.
Okay.
Syphilis, you get an injection, maybe penicillin, Pen G.
Yeah.
You want to get once off.
Yeah.
Then over sharp. The problem is more herpes. Herpes is some it comes and goes.
Okay.
You can treat it now. 3 months later,
yeah.
Then the genital warts on the medication there is an ointment Aldara, you can just apply it there. But you come getting a prescription,
yeah.
You just apply it there, then they are
so
depending on big they are.
Yeah.
Because others can be cancerous. But
Yeah.
before it gets there, treat them while they're still small. So they ignore, they can grow big depending on the type, they can grow.
Yeah.
So just use that ointment Aldara, then you're fine.
Push up.
But they can come back depending on your immune system.
Yeah.
Yes.
Are ringal bijonyana so ki doctor o ba ro ga banna masnenneng are la ra ro gone mothako e leng gore sa ne le tlalwana. Doctor, how important is circumcision and why should people circumcise?
Circumcision is important because number one, you look at the benefits of it.
Yeah.
Number one is the hygiene. You don't have to necessarily fold the foreskin back and try to clean because moloko ba le ntse ba reng ke smegma. Smegma is that smelly so.
Yeah.
So
yeah.
every time you clean so really circumcised simple you don't have to pull back. I also not change care.
Yeah.
Automatic. Then another thing it protects against HIV and AIDS at least by 60%.
Okay.
But not with other STIs. And then going to benefit our side, but going to enjoy a pleasure on at least maximized.
Okay.
And then another thing going to prevent cervical cancer.
Yeah.
More side.
Yeah.
Gore partner how you circumcised over simple.
Yeah.
But at least but it's not 100% guaranteed, but yeah, for good.
Yeah.
Yeah. Then another thing basically in general in terms of medical issues, condition phimosis. Phimosis you can't pull back the foreskin.
Yeah.
The small opening. So about two shall clear that. Le paraphimosis. Paraphimosis get foreskin so.
Oh.
So I go lona e ka kgono lead that to gore penis ela ihwe.
Yeah.
Go fa fela ihwe. Very ebe ischemic gangrenous so we can do a procedure with a dorsal slit. We just cut that and swelling circumcision later.
Yeah.
So in both cosmetic reasons, medical reasons, surgical reasons.
Okay. Yeah.
Yes.
Are in grow at the Dr. Cut, I did a Macutcut, Gamona Macutcut. Ragona. Yeah. le tlo le ntabe ya lena gore ke ya go tšhetša dikere.
You feel like change up gear.
Don't forget you're still watching 5 Minutes on the Streets. We are sponsored by Nkopo Stilll, TwRespect, and Young Bros. Now also. If you want to partner with us, yeah. I'm gonna drop the details. My name is FarryTheeMc on all social media platforms. I'm taking the questions from you now. Doctor, how did we fail to block COVID-19 to get inside South Africa?
Hey, I really you politic you are. Now the politic I get 7 selo.
Yeah.
But what I could say, COVID it was something I feel like it's man-made.
Yo, o question la very tlang go yona re tswele pele. Yeah.
Mara gore re stop I get 7 ne. La very stop living I don't know that.
So you really believe that on the theory or they are man-made diseases?
Yes, I do.
Why do you believe
so? Especially in terms of the virus. The viruses, they are, some of the viruses keep believe are already man-made. Like HIV. HIV khale be le kae. Ino tswelela mo sebaka bakeng ya to compromise maphelo a batho ba be le di TB and all that ba hlokofale ba nna re ma hormones or stuff like that.
Yeah.
So ke ntse le gore even re bala di research when it was so not bana le gore hey ba itjere di chimpanzee. I don't believe that. I feel like ba idiri.
Yeah.
Then ba thoma ba tseba ra ke rena le rata mapone.
Yeah.
The population control.
What do you want, lawyer?
And I believe that.
So,
I might be wrong.
Yeah, on the issue of population control, when I want to it's a good thing. Okay, the truth of the matter is that we are two men.
Yes.
Number one, and I want to live that's what I get.
Yeah.
So, and about Vajana. Na community nya ga gore go be lihu re tja ma 3 to 4 months re sa be lihu ora gore ene mara bana ba belego so we are too many bana ba belego every day mahu a be every day so don't you think gore dilo je di bohlokwa so gore ke re ke ne pelo mpi ke ra gore don't you think gore a re lebeletse dilo je ga botse re di tafuleng population control le bohlokwa
I don't believe in it because another very ethics.
Okay.
So our ethics do no harm.
Okay.
Respect a human being. Respect our pillar.
Yeah.
So people are population control.
Yeah.
Basically, they don't honor ethics at all.
Yeah.
But process euthanasia.
Yeah.
Euthanasia is divided, but I'm just gonna mention one.
Yeah.
You know, assisted death or death like I was saying,
okay.
Understand?
But
yeah. So I condone. But I not the or like it was so naughty. Government or state or one, but motono to naturally so or unnaturally because everywhere we go is just a risk.
Yeah.
That driver is a risk. Re-engage into certain activities still repose too much risk. I know about
risk.
Yeah, I know about risk, but the pelele risk jail. Mutum decide
Yeah.
Yeah.
Ke nyaka go tšhabela nyana ka mo ke bone gore re ka tšea ye nngwe ya dipotšišo so another question is that there were rumors that about the vaccine that people are going to die in few years like these vaccines also they were made for population control so how true is that and when yeah
the vaccines they're meant to protect you from getting infections.
Yeah.
Like a COVID vaccine.
Yeah, straight.
Now we learn that COVID vaccine I actually school.
We hlabile wena.
Nah.
Eh.
I'll reserve that one.
Bagala. Okay,
sure. It was a butcher Kgoete like egg.
No, okay sharp wena a ke re wena o doctor ya batho ke rena batho shiva re tlile
mara nna di-vaccine ke di tlhabile mo bophelong
ke nyako tseba I want to know specifically nna go bolela nnete nna ka e hlaba wa bona morago ga go nyakišiša dinyakišišo tša ka wele ke nyako tseba gore wena wa rra ge o e lebeletse o nagana gore was it made for population control na, and would you encourage your son or your family member to gore a e hlabe?
For population control a ke na information ntho e le gore ke witness it as I was practicing.
Yeah.
Ge batho ba fetso hlabiwa,
yeah,
ba bangwe ba be le di-side effects, ba bangwe ba le tsone, and terrible ones, you know, like headaches, ba phela ba le weak, matsogo a bona a oma, stuff like that. Which is, there were such cases.
Yeah.
But nobody wanted to account for that.
Yes.
I gona motho le gore nyako ja responsibility because le nna ke aga ka nela
ene ke mathomo re kwa tabe mo meeting a gona tabe ga batho ba mo matsogo
le nna ke gore like le nna ke aga ka nela gore le nna ke reng ka motho because le a ba re fa le mandate a se re manage jwa ino tswelela out of the blue, so le nna ke fela ke I will just manage the symptoms. Ke tsebe gore a ka thutela nna la mathomo, it was new to me, I never heard about it. So le nna be ke la gakanegong gore mara what kind of
ke mathomo bona vaccine ya mutolo
ke yone be rileng ka nakonyana ke itsebe wa ngushisha. So at some point be re feel free gore a ba ka se re gapeletswe e hlaba. Ke re still remember the speech by the president.
Yeah.
You're not forced to do this, it's fine. Jiki thomo ba mandatory.
Yeah.
Ra thomo e tlisha le tshogo e bona. So now I will encourage somebody to take a vaccine as long as it's about safe, ke confident ka yona.
Yeah.
That one was a controversy. Imagine go lwa.
I'm going confident ka yona.
Ke confident. Ka mo go itlaka tlakantšitse batho ba le gore ne ba le close to nna.
Yeah.
I'm not confident ka yona.
Wa shinga e hlabile o ka morela wa reng so?
For ngwana ge sho fu khotlelela. Hopefully the future ka se go tlele tšempe mara fo tswela pelo phele a re tsebe o ga se ntšha ke re mo mmeleng ke problem. So in the future I don't know how it will react jwang. What I'm confident about kitchen na ke di shumisitse mo go batho ke tse and they've been there for many years, like mo baneng bana they vaccinate them there.
Yeah.
Others they do vaccinate ka di flu. Also, they're confident mo go tsona because they've been there. Yeah, no tla ka pelanyana and then it tla ka tlakantšitse batho ba eish
ke bothata.
Ke bothata thomo ba le doubt nyana or why go dira so. Thomo lose confidence mo go yona unless if they improve it in the future.
Yeah.
Or okay, no. Then the trials they ba gona tse baya.
Yeah.
Tse le gore the evidence parking gore medical go na le evidence gore no this thing works, doesn't have side effects that is so it really protects you. But by Jerry you know worldwide.
Yeah.
So and then everyone some of the bad things ka yona but eish
yeah yo go kwele
yeah
ro kwele
yeah
na ba ba itsering a sena doctor mara ke wa ra re ya ilo tsika mo ka bonya ka ngojiria make sure just make sure. So can we move to the next one? The funny one, bara mojolo wa lenyesha le nna ka di PhD na
yalo tiaga guri ola nya go tseba gore Jesu Christ or bagi o go bisha ka moka
o re la masep awa abe bare one ruma e nngwe monna ba re doctor di rata basadi a ke tsebe gore a ke tsebe ke tsebile teka ke nnete mara tabe
wa tseba yo ke
maga
wa tseba how to mo categorize or
doctor
awa a re fore har to me re bia ga professional awa I nempe make sense because o tlo go re e motho re lawyer di rata basadi maphodisa rata basadi ma-teacher rata basadi wa ikushisa so ba gore ga o se doctor a se mantle ke ba ka go gana nne
Oh, yeah.
Before Jantwani wa haka mo.
Ah, ya go bona. E le headset je di se re mo ba di. Nna ba re ke di ga ba headset ya di.
Wa wena se mantle go ro ro hetsera 90% o tswa ka yona.
Yeah.
As long kore wa tse nngwe flop again. O kra ra o ga natse.
A tse boro dog.
A ka tseba mo. Ya change behavior. A ka tseba go regalang ka basadi because
wa kre ba gape ga mo South Africa ba sana stereotype to doctor le challenge.
Ana
ba ga ba le tšhelete o sharp.
Ana ba tsora te tlhakela
Ke botha.
I expect that you officially be disappointed pero ga di ba go regala go re mo kae mo yo.
Yeah. Are tsapele go ngwe ke tore tattoo malaba mo ki batho ba ba e witse ba re what's the danger of tattoos? Because go ne dipolelwana man re sa lebelle ya mmereko ga gona ile rong a di.
Okay, danger ke tsebang ya tattoo ne.
Yeah.
Re ne le tela e kena that it pierces the skin.
Yeah.
Those micro particles that the ink ne, they can go into your veins again.
Okay.
It can cause kidney problems.
Okay.
They can lodge there. Yeah. Then there's a be excreted. There's a just through the urine. So, it will cause a kidney failure.
Okay.
Yeah. So that's one of the complications that people don't really know about. Tattoo.
Yeah.
One understand.
Yeah.
Then another thing, it can expose you to infections, especially if the place is not sterile. I can remember our skin is not bacteria.
Yeah.
It's not the but they are harmless. But the moment they flow through the system, it can cause problems like sepsis. Sepsis is just bacteria, it affects the organs all over the body, all over. Then cause the infection builds up in your body because it's from the skin. That's why we clean the skin thoroughly. For a cutter, so that's another thing. Infections or bleeding, not really. Bleeding, not really. So those are the two ones. Yeah, the potential ones.
Well, when you go to tattoo, connection.
Oh, you can't donate blood.
I can donate.
You can't donate blood. Cross infection. Cross infection, if they use the same needle, then it can expose you to malarial hepatitis, hepatitis C, Ebola. So those are the reasons. You can't donate blood to such a tattoo. At least you must. What is a year or what?
Yeah.
Or 6 months.
When you go to connection, I talk ties to you. Like I've just gained the doctor friend, so I want to talk. Angagra, lot vein, whatever. Yeah. So, Dr. Mambuji saying we have a question. I get to know I get to begin to fro the fibroids. So, can you please explain a little bit about fibroids? What are they and how can they affect a human being?
Fibroids are commonly known as piles.
Okay.
Yeah. Ki di chica.
Yeah.
Tamo at the anal region agar. Anus. So they
okay.
They build up their sort of a growth that's
yeah.
So they are very painful, number one.
Okay.
You can see number two. And then ignore it. The first thing, cause is a lifestyle issue. That's number one.
Yeah.
Lifestyle issue, constipation. Yeah. So I get push. When you push the veins or the or the then the fish push
yeah.
Then I the former clots.
Okay.
Then the tumor over painful.
Yeah.
Then that's number one lifestyle issue. Other things, what syndrome, I'm not interested. But I give a number 20 fibroids. The issue is lifestyle.
Would you for the fibroids?
They are very great.
Okay.
There are these 4 grades of fibroids, but I'm just gonna touch the medical. Let me just touch them all. number one, di kgona go folela without treatment, especially ge se dira tswela ka ntle di kgona ba inside.
Yeah.
As mara o ka modify your diet, wa se di provoke ka constipation, maybe something that can loosen up mala a gago.
Yeah.
Asabe ba re keng the stool sit asabe tse thata.
Yeah.
Di kgona go tsamela, especially grade 1. Grade 2 le tsone you can manage them the same, di kgona go boela ka gare or a di tswele ko ntle.
Yeah.
Number 3 and 4, they can need surgical intervention.
Okay.
Medical and surgical intervention. Really painful, you give them something for pain, then you can give them the suppositories. Yeah. Small medication, you got to give bullet. Yeah. You just insert it there for pain, reduce the pain, the inflammation.
Yeah.
Then grade 4, grade 4, lentwela.
Yeah.
Surgically, is general surgeon specialist.
Okay, yeah. Okay. Dr. Macutcut, name Mbasi. Wawan. Kawa ka before ge no wala, we ge no wala mara ye. We ge sabone ak to mage mo no ka aguruguru. Ka to mo jam ka ke na gi wala to gi play door again. Le mai sama nchasin nage no shipta de wo sir South Africa ka moka. Ngoro boch. Mukabo uriagi piri or uriagi di yo or tagalagi or ke resort di sentana or uriga.
Alisha was malnutrition.
Oh, malnutrition.
Number 1 is malnutrition.
Okay.
I get like malnutrition. Aliji yo jape pagar. Lija maushwa, lija di sukiri.
Para ngasi ye papa sa juna hinek. Ngasi ye pizza ke dole hinek.
Kemo ka village wa no bi alawa sinu mates.
Oh,
I understand.
Yeah.
So it's that more. But batho ba go go no ba le malnutrition the same way bana ba go no ba le malnutrition like kwashiorkor or marasmus. O kre le gore ngwane a re gano mo na le freshana na le jimpana ha no alwala. O kgone go na ke rena. O kre re ba le ba bana ba freshana. The same thing can happen to adults.
Oh,
why one? That's number 1. No phelo le jwaleng nyako phelo ija bogobe ka nama. So that kind of malnutrition.
Yeah.
Then they can be easily converted to fat.
Yeah.
Alcohol can convert to fat. Sugar can convert to fat. It builds up on your waist. This thing may be metabolic syndrome. Metabolic syndrome is commonly seen in diabetes.
Yeah.
So everything can lead to diabetes. That's why I question, or is there any element of metabolic syndrome with diabetes inside?
Oh, yeah.
But there are certain things that I won't go through. Or you have metabolic syndrome and not. So
yeah.
So fatty acids they build up a guy.
Yeah.
The layers. The layers. The first layer underneath over the fat.
Yeah.
Then over muscle. After the muscle over the peritoneum. Peritoneum build up of fat. So we for the operation and so arrange when you cut you go deeper.
Yeah.
So there will be a layer of fat like this. A brick.
So
is a layer of fat and you can't really destroy that fat easily. That's why I really exercise last resort. They go through the surgeries where I forgot the name of it, but you focus the way you eat. I get others get diet issues.
Yeah.
So but they can reduce the size of the stomach. But anything, over a blockage, you have to go back to hospital. Liquid diet mostly. Or there are operation pill.
Yeah.
When you focus on that.
Yeah.
Size of the stomach.
Can it reduce your lifespan?
Yes, exactly. It can. It's up to obese. Oh, yeah, that's obesity.
Okay.
So only exercise before you get that stage, so you're gonna need surgery.
Yeah. How does it reduce your lifespan? No check more obesity game. Yeah. Bona. Male infertility, symptoms, causes, and treatment. mo community go ja ba blame basadi ba ro ga mosadi ya batho a sa tonyalwa ba re mosadi wa belege ke eng gane bothata bo ka mo brapo so ka male infertility ntse ka yona wara
male infertility I regis kind of ke isolator ke no infertility in general again ke ge couple e palla go ba le bana for a period of a year despite regular sexual intercourse unprotected sexual intercourse these people are trying like even they have it every day every week but they're failing to fall pregnant for a year. But if it's less than a year, we don't regard it as infertility at all. You just have to keep on trying. What the space or then I'm infertile. Then we start to investigate the two parties. On the male, it's quite easier because we do sperm analysis. Over mkone suvela ka mutil so re fidi tlaba ke retest la ba bothata mo ya go boja ngwana o fitla ka mo le ba go fa magazine or what the perek porn and stuff
a go no gore ba ka mpha mothunyana
ka wena ba dumela o ria ka ga o ditlisha because go ka ba le contamination di ka fella ke matla mo tseleng go se sabe the correct thing ba ne go ra fetso di dira ya ka lab ba o riela o tshoko motsoko ka kwa lab then wa chulela bana pe ba di test the same time o re tla le tsona ga e o ditsinje ka re ga plastic ka botho then but test the sperm analysis again okay, do you have enough sperms matured or not for report basadi ke mo le gore vale mo di buang vele mo la ba ke re monnela o sharp no o na le capacity ya go imisha re check mosadi again infertility is divided into two primary and secondary infertility. Primary no ba like you've never had children before. Secondary lila ba le bana before but la palela gon jwal. So that's why it require investigation or naman. You had a child before, then let's investigate. But more than investigation usually is just one. That one is sperm analysis. If we sharp musadi ram check okay. We're gonna take blood test, we're gonna check from top to bottom jwal. Or the hormones still from the brain and I want any tumors in the brain it or they affect production of hormones going there to the ovaries mole gore maya ke factory ya maya mole the ovaries I want any other issue I want any cyst or a polycystic ovarian syndrome I won't go into that is a big topic or I want any tumors around there cancers and what so not check inside the womb or I want any fibroids number one the fibroids are ka mela mola the blocker the job kono blocker the peu yela gore e kono fetal so dilo tshela gore we check them so mo go basadi is quite intensive they take trauma di ba check how the hormones are behaving in your body I want to lekang and what so not so it's a whole lot of investigations tshela gore ba di dira mo basading
ya kwala mrare bona any advice that you can give to ba gore na gwa gae le botata gore na gwa gae ba le busy ba ro gang dingwetsi ba re ba belege
a gona a room e le gore ka khona ro ga mosadi a go shisha o swa the check up e le gore eno eme mo seemong se se feng understand because winchi vele ba rogiwa left right and center and o hotse re motho a go rogang ena ana ngwana maybe ka ntle or a relationship a startileng ka yona understand so le bo mme le tlogele roga banna le ra ba imishi le nna le te checkeng because it is a one way stream for both parties hotse re ka mkana ga nna le apalla vela nna le mathata or maybe monno na khono ba le ngwana before party ka go bane ya no tratela cigarette le bala these days wa le di sperm cells tshela di agwa sa khono tswela pele so both parties must just check for what or khono increase the population like re control ra increase
a go tiwe moane ngwana ka mkhalo go wa a re tsweleng pele wa are why women shouldn't drink alcohol during pregnancy?
Ever exposure to fetal alcohol syndrome.
Okay.
Fetal alcohol syndrome it's a condition e le gore e affecta basadi.
Yeah.
Ba imile o fela.
Yeah.
So gore maybe ba bang ba tse gore ba imile but they drink alcohol.
Yeah.
Ba find out mola gore ke missed the periods.
Yeah.
Kanti motho ene ele radi party ya sa miss gig. Phela or maybe we're addicted to alcohol.
Yeah.
Mara o rata mapone.
Yeah.
So we'll find out later. Right, but yeah, no matter how much you be,
Yeah.
so already the damage has been done because
Yeah.
pregnancy is too sensitive.
Yeah.
It can expose the child to missed miscarriage.
Oh.
Missed miscarriage is the matter of fetus. I get is a fetus.
Yeah.
Emotional. That
That
fetus is usalemore ya segola o ya doctor nga rutira sona no heartbeat or ba no kra ntshong ba re ke like I gole at all maybe I get rela sona today nga normal I'm not certain or we ra halang but you are pregnant. Can come maybe in 2 weeks or a month. Is there growth?
Yeah.
Or there's nothing.
Yeah.
So what they do, they just clean you or that.
Okay.
So another thing, they're just reluctant. They have a canceling or about gushies. They just wanna drink alcohol because of stress or whatever reason.
Yeah.
Their child abeleo. Akabali so many disorders mummeling.
Okay.
Samatomo agarbarabana di Mongol.
Yeah.
Bastaraga school.
Yeah.
They affect the school performance or growth. Ubale started growth like agole kamukwasono gore motho a gole ka gone. Or ubale di dysmorphic features.
Yeah.
Or what do you call ubele ga le di anomalies ba re ke di congenital anomalies like malwetse le gore belwa ka one.
Yeah.
Disability. O kere ngwana hloka nko. Ora hloka tsebe or fatlego se jikile se me ka mo.
Ile sa bana.
When or hlogo ile ka watsa ka mathata because of magonale irresponsible. So that or I have a little genetic diseases. So there are so many things still already they can affect ngwana.
Yeah.
And then ke ma setla pele o hotse re ba le go disa ngwana le go ra o morata o fele jo molahlela ka gare ga dustbin ba
go bothata bana re togole mogwa sa bana re tle ka bua mpeteng a
ene sonjoro wa test the pregnancy.
Yeah. No. O sa go bolela
awo
ke a rumela ke re nna ka ga se mental health rena le rula ka di health tse dintsi mara gona le nngwe ba re ke mental health matala no phela lla ka yona credit to you brother, we see you. Yeah. Matala no phela lla ka yona mothakolo ga no da podcast ka ke tsolo tso tlhagela ke matala wena and this is the right platform wa ka go tla go no botsa batho ba ka tabe. I've been inviting Matalani since 2021. Since 2021 ke mmotsa ka tabe ke re monongo tle go podcasting are ke sa le busy ke kae ke a bo ke kae ai a re tlo mental health mpotsa ka mental health mo gone.
Sure, it's okay. Mental health is very broad.
Yeah.
Unless you go specific on one thing.
Yeah, ngono mpotsa ba bang ba go shore mental health ke nga ke re tila le batho ba go specific.
Yeah, mental health is not all about malwetse. It's about emotions.
Yeah.
It's about psychology per se, which incorporate emotions, emotional well-being, and also physical well-being, and financial well-being, socially. So there's a lot of things mental health.
Yeah.
I think it's general. I think gonna be specify on my weight.
Okay.
Yeah. So in terms of socially, are you able to socialize with people now?
Yeah.
I want I saw no motho gore a kere others ba tenya ka ba noshi.
Yeah.
Aba khone and re lebella gape le taba gore ga o phela o noshi.
Yeah.
O hwetša le gore you are suicidal.
Oh.
you're suicidal, or not only one, you can't build relationships with anyone. So Leona suicide is one of the things. That's why Matalana push.
Yeah.
Our men must speak out. That's di
Yeah.
understand. So it's something suicide is number one. It's taking a lot of males. Remember, even during that walk, you go from Polokwane to Pretoria. Yeah, men speak out. That day, before Riga Fitlale, or Fitlale Union buildings, I think there was a guy who hanged himself on the trees. Hey.
Yes.
I understand. So this thing is starting to be an epidemic, or a pandemic. So so another thing about mental health, you must take care of your emotions. You must control your emotions towards associating with other people, because anger can destroy things, relationships, can destroy associations, it can destroy any other thing when you burst into anger. You get what I'm saying? So physically for you, I can know other people, but they're quite stressed, they can just cut themselves. They can just I ka kgona dira body le harm ena te go batja a nyaka attention at tlhaganya mo fase a actor aba hysteric ke go ba hysteric go try to grab attention because we feel like ona neglect somewhere ka ra ba go hlokomele or o nyako di satisfy ka dilo tsa motho mongwe mara wena o nyako di direla tja gago, then you throw the tantrums around. So there are people like psychologists, and I'm not good at counseling, but there are people like psychologists where they can assist you, give you counseling, talk to you, or there is somebody who you trust that much. So mental health is a very big topic, man. Let's say specific. Or bipolar, depression. It's very big, eh?
I'm trying to work.
But mental hygiene is very important. Guys. Let's cover or sleep paralysis. Or another thing I can advise on mental health, be active, be adventurous, cover in one place, explore, because your mind how refreshed, better, you can make informed decisions. Go hiking, man. That's not the way to go. Walk, take a 10-kilometer walk. Well refreshed. You know, go fishing, swim. Black label. All miserable. Not refreshed. We took some walks. No. Protect your mental health. Because the Tomo question, or while you're doing those things, are you stressed enough? We not about stressed about. But we try hard, or regular stressed. Try it. Go for a walk, listen to music. Go to a shop, you take a shower, and then you deal with your stuff.
Mental health, these things, take them into consideration. I'm going back to my questions now. I've been answering your questions, so I'm going back to my questions now. Sex addiction, explain. Can you please explain what is sex addiction?
Sexy.
Sex addiction.
Wasn't thinking when you posted about my God Facebook. Let's like a tomaga.
I want you to explain it at the medical level. What is sex addiction?
A way you indulge into sexual activity, you compromise socially, mentally, physically, emotionally, or something like that. So for an example, tšwetša pele.
Yeah.
If o ba compromise sexually, o
Yeah.
tlo kry-a ke dutse le wena nomo, and then o nyaka o masturbate, o spill. O pata ka mokhoneng, eya. Maybe o ka no re tsena mo di-bathroom wa re one wa bo. O hwetšela gore maybe partner like already that's an addiction. Socially you can't keep up.
Yeah.
Wherever you are at work, you know you masturbate. You understand?
Yeah.
That's another sign of addiction. Or you are alone.
Yeah.
You know throughout.
Yeah.
Understand?
Yeah.
So you stable socially.
Yeah.
Then another thing you watch porn.
Yeah.
And porn, Leona, it's another thing of another side.
Yeah.
So another thing, or your relationships don't work. You always fight with your partner.
Yeah.
Or maybe in bed.
Yeah.
Then you try to find other partners.
Yeah.
Maybe you feel like
yeah.
Then you have multiple partners.
Yeah.
You move on to this one, you move on to this one. You don't care at all. So
Yeah.
that's good sign. There are so many signs.
Yeah.
Okay. And other things get rape.
Yeah.
When you rape multiple people, 50 counts of rape. That's another
addiction.
thing. That's sex addiction.
Yeah.
Or but the pedophile, in relationships with kids.
Yeah.
Or they rape them.
Yeah.
Because we're underage, you know.
Yeah.
So there are so many. We can talk all day about this.
Yeah.
Then only other types of disorders.
Let's talk about how dangerous masturbation is, because a lot of people masturbate. I want it in terms of mood health. How dangerous is it is to your health, masturbation. But go to your yeah.
You can underperform.
Yeah.
Or you can drop out.
Okay.
Because you don't prioritize our not than the book. And the problem is how fetish or masturbate.
Yeah.
Or satisfied can't only
Yeah.
like I get your mind is also like have a sex.
Yeah.
Your mind releases the endorphins, the oxytocin, the feel good hormones. Our one after sex is quite a block or abnormal.
Yeah.
You must
Send you over Valenya.
send your nepinya about quatel. Understand? Because you release that hormones, you feel like you are high, you must relax. Understand?
Yeah.
That's the way to go.
Yeah.
So masturbation can take away, can perform poorly even at work.
Yeah.
Again. Then another thing, poor social interactions.
Yeah.
That's another story. And then maybe you have feelings of regret.
Yeah.
You'll have feelings of regret. You feel like I'm a fellow. Feelings of regret that won't go away.
Yeah.
So basically, you can compromise anyway. Okay, you have a deal. Maybe I would try to how can I tell you about a deal? Oh, I'm fine. So one of the things still
yeah.
Masturbation or compromise it's very dangerous.
Yeah. And watching porn, how dangerous it is to watch porn?
You will no longer feel your partner.
Yeah.
Like sexually, you will not feel your partner, I think. And especially in Lebanon nowadays.
Yeah.
They've got smartphones. So, and then they get damaged by it.
Yeah.
That's again.
Are triple X
Also, all day, got things.
Yeah. What causes low libido? Libido erection. So,
yes.
Yeah. What causes it?
What's in a classify as one year?
Yeah.
Give a like one.
Yeah. ka a re bolele ka banna ke re ke
Oh,
basadi ba phela ba le on ba emetse re
yeah, ba off. Okay, banna low libido. It's something still classified under erectile dysfunction.
okay
Like you don't function at all. I agree. I can't erection or I can't maintain.
yeah
So if you can't maintain or get an erection,
yeah
definitely you have low libido. But another causes, psychological causes, medical causes,
yeah
trauma, and what's not. So right, classify. If medically we look at things like hypertension, high blood, or we look at diabetes,
yeah
or we look at other autoimmune disorders, or we look at spinal issues,
yeah
spinal disorders. Then psychologically, then what are the sexual dysfunction disorders?
yeah
Are you suffering from that? Do you watch too much porn? Do you masturbate?
yeah
That thing, it can reduce your performance.
yeah
Imagine you masturbate now, you want to have sex with somebody. You're not going to perform as usual.
mara ba gone ba tsara ba re
Mm.
ba re mosadi before it I heard this story ba re mosadi before it ba itia one ba re ba tia one ya matla and then mosadi wa ga to fihla mola la pele o tsoro mo kry ka two o tsoro mosadi wa ba re e tamano
ba thabelo botsa ra ba perform.
Oh
A o shala ko monna ba la tsona tse a
Yeah.
perform when wa suffer.
yes
You suffer from sexual dysfunction disorders
oh
or sexual function disorder. Wow, wa suffer the moment that Tomo Rutel talk before Gram side,
yeah
already that's an
o le
illness.
bothata yo
Yeah,
monagano
go na le bothata mo.
aish
Why should you do this? Wa ke re mosadi a ka go forgive.
eh
Wa re one go yena la khutse la re two. Why should you do so?
why what
Two tlo last
and le
time.
one o ka no kry ka BJ wa ba shapo ra tswela pele
Simple as that. A o sha lwala o.
yeah o bothateng
Bothateng yo bogolo.
yeah
So ne ke sa tswela pele ke re go se bene ke re.
o mpotsa ka lo lebito re bolela ka lo lebito
Yes, sexual erectile dysfunction.
yeah
Again.
yeah
So psychologically re boletse ka yona. Watching too much porn,
Yeah.
masturbation.
Yeah.
Le gore maybe you are scared to perform.
Yeah.
O a ke re mongwe a re ha ile go mmolaya le gone.
yeah
A re a na le matjato.
yeah
A o na le performance anxiety. Gore o
Yeah.
se jaja gore go performa jwang go mo khotsofatsa na o se butse diputso tse ntšha fitla go yawa.
yes
And not gore wa lwala.
yeah
O na le sexual anxiety.
oh
Or anxiety to perform. Gore o se I ntolo fo tsene tsa gore o nagana.
ba tlo ruto robala
Go se se re tle re bolele ka yona tabe.
yeah
So
mm,
then re lebella malwetse me se boletse ka yona diabetes and hypertension and
yeah
not
yeah
trauma.
yeah
Motho ile go bala na maybe the accidents ile go bala spine sa hae
oh
or maybe na le gore ile ba le sort of infections around the genitals.
Yeah.
Every gonorrhea can cause that.
yeah
I understand that. So there are so many things we look at
yeah
Everybody prostate cancer, do you have prostate cancer? So we look at it holistically in general.
yeah
Yeah.
okay so ge motho a ne le low libido
Yes.
di bo mashabela ba rekisa dile ba reke di moringa what le tso di a
Yes.
bereka nka kgona go nwa dipilisi ka ba le erection ya ka ya kgona go emelela ka lebijwana
I guess we try, but checking sugar jona ke di recommend the patients.
di gona dipilisi tša go
Yeah.
oketsa libido
Ka re ka kry-a gore a fele parking depending on the cause.
Yeah.
Because you fix the cause, then this
Yeah.
person goes back to normal.
okay
I get it.
yeah
Then we advise, we look at you if you are young, somebody who is healthy.
Yeah.
I don't know any indication of malwetse and stuff.
yeah
Psychologically, we evaluate you.
okay
By one, and when and your partner. Okay, le gore how mo feel maybe.
Yeah.
I fish ka mokgwa o mo nyakang.
Yeah.
And then ba bang ba irang ka mo next door. We ask them these questions. Actually, what perform? Mara ka mo ga ya perform.
oh
So that's psychologically as
Yeah.
well.
okay
Maybe this is not the right partner for that person.
yeah
I'm feeling so. Mara actually what perform?
Yeah.
So those are the kind of things. Or ba phela ba mo manya ka mo
Oh,
o bala
mo
ngqondo.
ba ngqondo. Yeah.
Wena o phala ke semamang, wena wa swara selo, ke jona je. Banna ba riang,
Yeah.
wa mo nyenyefatsa wa kushisa.
Yeah.
Ke mo ka riang a sa performa the way. But actually ka montle ba mo thabela.
Yeah.
O ria jona wa kushisa. So
Okay.
ke one of the things. Ba ile gore ba godile. O kry re o lanya ke ditlhare o nyaka counseling.
Yeah.
Ba godileng maybe ba affectile ke malwetse na le maybe hypertension and diabetes. Ona le certain medication we can give them gore ba kgone to boost their libido. Which is it ranges from, there's a thing called Cialis. We can give them Cialis as long as malwetse ba na le controlled.
Yeah.
O ka se fe motho high blood le go godimo or mo fa Cialis o tlo mmolaya.
Okay.
Or o tlo mo cause di heart attack and so not. So mo fe the lowest dose only when the condition is controlled.
Yeah.
The lowest dose of monitor engine na kuya copy one or perform jwang.
Okay.
So they usually respond to that, but we encourage them or don't rely on these things. Rather try exercising, modify your diet.
Yeah.
To improve. And that's it. Well, gore totally ba kgone go maintain that erection. Maybe an spinal injuries through the accidents or baba betile or so not.
Yeah.
I don't know about rehabilitate. There is nothing you can do to fix that.
Oh.
The nerves still and you can't really fix a nerve. So
yeah.
I was at the
Dildo is the way.
I don't know about it's just rehabilitation.
Okay.
Rehabilitate them.
Yeah. Do you believe in polygamy?
Polygamy?
Yeah.
Yeah, ge ke tlo nyala. Gape go njolo ka area ba tlo wa cheating.
Yeah.
Yo o bona because ke thomile le mo gore man monna ga botsa ka se khotsofatse ke mosadi ka o teng.
A o kgone.
Wa jwang if ba re khotsofatsa gona be re ka se fele re kutswa.
Yeah.
So wa avoid go dikutswa. A go nyala fo botsa mosadi or before le ka nyalana or a so eno mafelelo.
Yeah.
Ba tlo tlisha ka mo.
Banna le bolele.
One net.
Na wa ka ke mmoditsa ke tsebe ka lena ke ra gore le lena le mo di.
One net awa. A re bolela ka one net o tlo go kwishisha.
Yeah.
A re bolela ka girlfriend and boyfriend. A ile bole ka seloke.
Yeah. Polygamy is the way.
Is the way, is the future.
Yeah, I think also it will reduce the ya go cheat because
exactly.
Ntwe basadi ba gana go understand. Ke fela ke botsa batho ke re malapa mantši a emeletse mo is because go ne mo mamncane.
Yeah. Ba tisha lapa le.
Yeah, the time tše dintši a ke rena re na le bo papa go lena maiwala le na le tseba. Nna rena le bo papa go lena maiwala go maiwala re a bona gore ba fela ba re before ba ya ka gae.
We check the anonymous posts by but when you are happy.
Yeah.
They want to have tunyana where not disturbance.
Yeah.
Well, let me say you already know. Hey, I don't know. Yeah. Polygamy is the way of it.
Yeah. Why do women broke women think or about basadi ba broke? They don't accept or ba broke. Ba nagana gore they are dating the wrong guy. Basadi ba le broke ka moka ba nagana gore they are dating the wrong. A gona mosadi a yang go amogela gore mam broke. No, I'm dating the wrong guy. Why are they having such mentality?
I wish we can have mentality over like a Arab. But naki well go guy number one.
Yeah.
The influence you creating around.
Yeah.
Like ngor play mabatswadi what so not. But naki believe gore o bona bala ba gale.
Yeah.
Ne? Ba na le understanding than ba gonjwala. Phela gonjwala there's too much influence. Ba bamba re bophelo ke vibe like lavish lifestyle. You must buy expensive clothes. You must get a rich guy.
Yeah.
But tell each other that because they use their smartphones to check out these kind of things. But believe it, that's their life.
Yeah.
They're not too much level of background or I come like mama look for somebody. They're not too much like a boyfriend they higher need.
Yeah.
But now I think people will our side.
Oh.
It's some
professional help.
Banyaka professional helping way serious. Because everything nowadays Monas natural tasman.
Yeah.
Monaka wam side was pay. Why is that?
Yeah.
Okupala le 2 million fast. you know, you grow together.
Yeah.
Le bontshana I mean, le kgone correct the struggles tša lena.
Yeah.
Mara still no spill. Why is it? And it's not like they are happy to the other guy. I lo sokola. Because okay, kra monna le khureng wa fihlo tlo go sokodisha ka kudu. O stale sharp. And that thing, they get lonely la mathom. O tlo mo fa tsona tšhelete tse ba fora tša 20 nyana she. Correct. Mara ba mo control. They're not happy. They're just there for the money. And then at the end of the day, over depressed. The same guy goes out. We had a business meeting. We don't experience the love.
Yeah.
And it's not like the guy is poor. The guy who knows something, but I reach level
Yeah.
But to maintain. And in two percent, monna always enjoy na atlanka ka singonyana.
Yeah.
Ka mongare a hammer na le maswafo ba na rena le dipelo in emotions ra hem. Pele ya bora o krele gore phelo go pela tšhelete.
Yeah.
Mfitšhelete ya manala ba no rutliša ditše useless ka gae. Mfitšhelete ya meriri. Mona le moriri o tsenya moriri.
O palla go reka roll on. O palla go reka roll on at 30 rand. I always tell my my girlfriends or not I don't like if you go to tell I go
fazaka o broke tlala some things is solid, some things is tangible se go thuša ka mogae. Nka se go 5k wa tla mo rekile Brazilian net retao o reketse manala 500 o rekile seeta sa go dura le watch and makeup
wa palela
ke monka tlanya no swere something se tangible rije. Maybe alright man, baby, let's go out, have a fun adventure nyana. No understand. Maybe na le van no naganele bana wa ngushisa wa motho mo a tsake ngale nyala le ska nyala batho ba le tlogotse ba buaga. You must choose wisely. But nna ke nagana gore ke mental disorder. Ba se get hooked very easily. Angushisha ape mosadi aga kgone go tlogela mo a lata motho kgono jive
ke bolwetse
angushisha simple as that. They're just loyal to their feelings, so they need serious help. And they damage us in return. O kgone mo hlokomela bra ka monate mara kgone go tlogela for somebody are better than you. Not gore yes ba lucky ba ya mafulong a matala
ba bangwe ba
mara ba bangwe ba fitla ka go ba te tshola and you can't take that woman back. You can't. Ba bona ke mental disorder ba sa ba rena se ba need help shem
di doctor
and the doctor na re fotla ba injection
ya ka psychologist
psychiatrist.
Ke to question tse pedi tša mafelelo ka re ntse bo sa bolela re batho ba lebella ba ga no tlogela ba ya go motho go bina when you see skomota and shebe shit,
yes,
what can you say?
Na molanga re modimo ke mogolo shem.